All right, good afternoon. We just wanted to bring you another video about one of our testers who had a chance to use the ErgoFinger. This is Jennifer Clark. She's a hygienist, and I'm going to tell you a little bit about myself. I am Becky Cole. Been a dental hygienist for 18 years. I'm going to be the United States representative for the ErgoFinger. As you may know, the ErgoFinger is a disposable finger attached to HVE. It controls aerosols and it allows you to maintain ergonomics while you're working with the ultrasonic or the polisher and control aerosol. So ErgoFinger, small, and it comes in a large and extra large. So Jennifer, thank you so much for coming today. We really appreciate you giving us your time. I would love for you to just tell a little bit about yourself.
My name is. And I going graduate dental hygiene school, so I am approaching, dare I say, my 30th year in clinical practice. Of those 30 years, the last 28 years have been in the same private practice.
So you were a tester for the ErgoFinger. How long have you been using it now?
I would say close to 8 weeks.
Okay, and how many patients do you think you've got to use it with?
At best estimate, 65 to 70 patients.
So when you got the ErgoFinger, did you get the lightweight hose that comes with the kit?
I did.
You did. And how was that installing it? Was it hard? Was it easy? How does it fit your unit?
It was not difficult. My doc and I had it assembled in about 15 minutes time. So it was quite simple.
And how do you feel it is working with that hose compared to if you were to use it with maybe the other hoses that come on units, like the metal hose or the other hoses that come with those units?
The hose that we removed was significantly heavier. Definitely more of a draw on the wrist and a posture concern. The hose for me is absolutely vital.
Yeah. All right, so when you first started using the ErgoFinger, what were your impressions of it? What was your experience with it?
Quite honestly, after watching some of the instructional videos, I adapted pretty easily. It was quite natural with the finger attachment. I've played with both types of grips that are shown in the video, both the one that you allow the hose to remain in the palm of your hand and also the wrist wrap technique. And I find myself almost methodically changing them without even thinking about it, just depending on where I'm working in the mouth.
And when you're using the ErgoFinger, how do you feel? Is it easy to use the mirror? Was there a learning curve for you with that, or how did you experience that?
I would say there's a little bit of a learning curve. I mean, no different than adding a new scaler to your instrumentation or anything like that. The one thing that I did find with the mirror, particularly on the lower anterior quadrant, I find that placing the ErgoFinger on the facial aspects of the teeth and the mirror on the lingual aspects of the teeth allows you to instrument almost as you're naturally used to doing.
So when it comes to ergonomics, how do you feel are you able to maintain that? Do you feel like you're able to move around the patient a little bit more? How is that experience for you?
Yeah, the ergonomics have been great. I consciously tried to maintain my elbows close to my sides, which keeps me at the 90-degree angle. If you can do that, your shoulders instantly relax and keeps you in a great spot. As opposed to before I got the ErgoFinger, I was trying to utilize the standard HVE tip, which is quite long, and that hose quite heavy and most uncomfortable. So for the most part, I was surrendering the Cavitron to just strictly hand scaling, which, as we all know, is a lot more work.
Yeah. For sure.
Yeah.
So the procedures that you've used the ErgoFinger with, what are the main procedures that you use it with? Do you use it on every patient? Do you limit the number of patients, or you just getting to the point where you just can't live without it?
Well, I don't use it on every patient. We are a general practice, so I have, you know, from 3-year-olds up to 100-year-olds. I Anytime I'm using the sonic instruments or I also have a ProfiJet attached to my unit, and I absolutely use that with the wider tip.
Okay. So how do you feel like that wider tip works when you're using the air polisher? Do you feel that it's more effective because the borehole is bigger, or how do you feel about that tip?
I like it a lot, honestly. My patients who love the ProfiJet, they love the way it feels after the procedure, but admittedly, they always refer to it as my saltwater shower. So it can be a mess.
Mm-hmm.
And I am seeing a lot of positive comments from the patients. It is, I am not seeing splatter on my shield as I did before, and it is definitely increasing patient acceptance.
Awesome. Awesome. So you kind of talked about splatter and the aerosols on your shield and that kind of thing. So when you think about how effective it is for controlling aerosols, when you implemented this, do you feel a lot more comfortable now that you have this and you're able to use the ErgoFinger and use aerosol producing tools?
Absolutely. I feel like it really is, a game changer for me. It has restored my confidence in using the ultrasonic scaler, and my patients know that. I actually had a case yesterday. I had someone who had shied away for the last, it's almost 2.5 years since he had been in the office. Mm-hmm. He's one of those gentlemen who, I broke something, so it's time to go. And, we get him in the hygiene schedule and get him cleaned up and get him restored. And then he goes away again. And I asked him, I said, you realize you're putting yourself at risk for periodontal disease. He was almost a complete ANUG on the lower anterior because of it. And I said, why do you do it? Why do you stay away? And he said, it's not the office. It's not you. It's not the procedure. He said, I always feel like I'm drowning. Mm. So I thought, okay, so here's my opportunity to, restore some confidence in him. And, I said to him, we just, are implementing this device. It is key. I said, I've had great experiences and great feedback with it. Can we try it? And he said, yeah, absolutely. And he did fantastic. And he walked out to the front desk and he reappointed to finish his SRP.
That's awesome. Those are the kind of experiences that we're really hoping that patients start to experience with the ErgoFinger. Like you said, with the air polisher, that can be such a mess. And not having our shields getting dirty, then we know that aerosol's being controlled and we're being safer. So yeah, that's really awesome. So you're getting great feedback from your patients as far as using it.
Yeah.
That's great. That's great. Do you feel that with some patients, it might work a little bit better than on other patients, or is it pretty universal? It's pretty easy to use with everybody.
I mean, I personally, from a clinician standpoint, I think it is, it's easy to use. You do get the patient who, their cheeks are a little bit, in the way, or they have the tongue that doesn't quit. And, once in a while, you're going to catch their tissue. But because of the material that the tip is made from, it is a much more forgiving material, and they're not getting that hard plastic stuck.
Yeah, I feel like when I'm using it, because of the holes in the side of it, when it sucks the tissue, it doesn't just go there. If it does go to the tissue, it's very easy to release. It doesn't cause a lot of issue. So, yeah.
Yes. Yeah, and
I
find get it to release quite easily just by changing the position of it a little bit, and that's it.
Yeah. Well, can you think of anything else you'd like to talk about, or anything else you'd like to tell people who are kind of on the fence about whether they should purchase the ErgoFinger, or what would you say if you could tell somebody?
I would say it is the one device that's at my disposal that I can't do without. If you are on the fence, get off of it. Try it, and it will prove itself.
Awesome. You gave me goosebumps because I'm so excited for this product to come to the United States. We have worked so hard to really get there, and the good news is our first shipment left the warehouse today, which means it's on its way. So those of you who have ordered, your orders are coming. Those of you guys have kind of waiting because you're wanting to wait to get it, it's coming. So Jennifer, I really appreciate you giving us the time today, answering us those questions and helping build confidence for people who are on the fence about buying it. So I really appreciate it. So thank you so much for your time today.
Certainly. My pleasure.